News on the Zika virus is spiraling out of control. Here's what you really need to know.
Zika virus's history has been relatively short. It was first found by scientists in the Zika forest in Uganda, hence the name. However, it didn't start to spread until 1969, where it traveled to Asia. Reports of the virus were not often reported due to the similarity to dengue and chikungunya. In 2007, the Pacific island of Yap had the first large outbreak, which led to other outbreaks in the Pacific Islands. In Brazil, illness with skin rash was reported without the test for Zika virus due to the common symptoms. Many believe that the World Cup created the extensive spread. Now, many see Zika as a world problem.
Before 2015, Zika was seen in Africa, Southeast Asia, and the Pacific Islands. But by May 2015, the first confirmed case of the Zika virus appeared in Brazil. In general, Zika is most prevalent in Central and South America, and in Mexico and Puerto Rico.
When people acquire Zika to the time they show symptoms is unknown. However, it is said to be between a couple of days to up to a week. Symptoms of the Zika virus include skin rashes, muscle and joint pain, conjunctivitis, aka pink eye, malaise, which is a general feeling of discomfort, illness, or uneasiness, headaches, and about 1 out of every 5 people infected become ill with a fever. These symptoms usually last between 2 days up to a week. However, it is not uncommon for people who acquire the virus to need to go to the hospital as a causation of the unavailability of any vaccines or treatment. Good news is that very rarely do people die from Zika. However, while this may be the case in both French Polynesia and Brazil, scientists have recorded that some individuals who obtained the virus were later diagnosed with Guillain-Barré. This is a rare disorder in which your immune system attacks your nerves. The result of this is muscle weakness and sometimes, in extreme cases, paralysis. The Zika virus is primarily carried through the bite of an infected Aedes aegypti mosquito. An interesting fact is that only female mosquitoes bite people. The reasoning behind this is that the females need blood in order to lay their eggs. The mosquito's saliva actually contains proteins that keeps the blood from clotting. They thus inject the saliva, which in this case is carrying the Zika virus that is being expelled from the salivary glands, in order for the blood of its victim not to clot. This is how the Zika virus is transferred into one's bloodstream. The virus is primarily transmitted through the bite of an infected Aedes aegypti mosquito. This mosquito is unique as it also can carry chikungunya, yellow fever, and dengue. Zika can also be transmitted from a pregnant mother to her baby during pregnancy or around the surrounding time of birth. While the virus being sexually transmitted may be rare, it has happened on 3 separate occasions worldwide. Sexual transmission is only thought to be able to spread from men to women.
Although Zika causes no lasting symptoms or harms, it is a great danger for pregnant women. This is because Zika is suggested to be linked to microcephaly, a disease which causes small heads and damaged brains in infants. The most cases of microcephaly are seen in Brazil. Unfortunately, there is no treatment for microcephaly, only therapies to deal with the consequences. Similarly, the Zika virus has no known vaccine to prevent it. Doctors suggest wearing long or thick sleeve shirts or pants and staying indoors to avoid mosquito bites. When diagnosing the Zika virus, tests can be deceiving because 80% of those who get the virus don't feel ill. Blood tests can also be performed, but these only work in the first week or so after the infection.
Recently, WHO had an international meeting to discuss health concerns related to the Zika virus. They made extensive plans for the future in order to contain the outbreak and inform the public. However, no action has been set in place yet. The meeting prioritized attention to pregnant women to prevent Zika virus or provide all of their options if a woman has already contracted Zika. As of now, there is no restriction on trade and travel. However, visitors need to be provided with accurate data to reduce exposure. Overall, the meeting emphasized containment. In order to contain the virus, sharing data between countries will be extremely important.
South American countries are asking women to avoid pregnancy in order for them to avoid microcephaly. This could help economically as it decreases their population growth. Socially speaking, this request raises issues in countries with a strong presence of Roman Catholicism. Contraception is aligned with abortion in these cultures, causing women to experience ethical and social issues when attempting to avoid pregnancy. Pope Francis vaguely addresses the Zika virus issue when saying, avoiding pregnancy is not an absolute evil. This could help justify contraception, however not directly.
created using Powtoon.